Maharashtra's struggle against COVID-19 crisis still continues. The state recorded 31,855 COVID cases in just the last 24 hours, the highest since the pandemic. It's now over 230,000 active cases that currently stands. They also recorded as many as 95 new fatalities, taking the total death toll to 53,684. Mumbai recorded over 5,100 cases on Thursday, the highest since the outbreak. Case fatality rate in the state now is 2.9%. The centre has now confirmed that dual mutations found in the country, especially in Maharashtra, could be possible reason behind the 17% rise in COVID-19 cases in the state since 1st of March. Now, I'm going to take you through all those areas which have recorded the highest positive cases, including that of Pune, Nagpur, Aurangabad, Nashik also recorded the highest positive patients on Thursday itself. Let's take you through what kind of curbs that have been imposed in these areas. Nagpur lockdown has been extended until the 31st of March. Nanded, the lockdown is from 25th of March until the 4th of April. Shops to be open from 7 a.m. to 5 p.m. Pune, schools, colleges have been closed. Night curfew is in place. Thane, 16 hotspots under lockdown currently. Amravati and Akola has reported night curfew. Now, Bede has lockdown from 26th of March until the 4th of April. Nashik, partial lockdown with shops open between 7 a.m. to 7 p.m. only. No gatherings in post-March 15th. Aurangabad, they've reported partial lockdown on weekdays, complete lockdown on weekends. Shops open between 6 a.m. and 9 p.m. only. Now, after December 18th last year, coronavirus makes its biggest jump in the national capital, Delhi. It reported 1,254 fresh cases in just the last 24 hours, taking its active case tally in the state to 4,890. Delhi also reported 6 new deaths in just the last 24 hours, taking its death toll to nearly 11,000 since the pandemic began. Now, meanwhile, positivity rate at the capital currently stands at 1.52% and recovery rate at 97.56%. Many states have introduced local lockdown and ban on public activities as coronavirus cases sees a sudden spike. Schools in Telangana, Chandigarh, Puducherry, Uttar Pradesh have now been shut. The centre has written to all states to increase testing and contact tracing of COVID patients in order to contain the spread of the COVID-19. Now, on a day when India reported over 47,000 cases, the Health Ministry revealed that a new double mutant variant of the coronavirus has been identified in India. But what is this variant, and is the spike in cases really related to this double mutant version of the virus? Let's take a listen at this report.
This day a year ago, India locked down to keep the virus out. After handling the first wave of infections, today the country is battling a new wave. India recorded 47,262 coronavirus cases in the last 24 hours, the highest since November. Now there's a new worry. A double mutant variant of the coronavirus has been found in India.
इन 18 राज्यों में मैं आपके सामने लाना चाहूँगा 771 हमारे वेरिएंट्स पाए गए। कुल हमने जो है 10,787 सैंपल्स जीनोम सीक्वेंस किए। इसमें 736 तो हमारे यूके वेरिएंट मिले हैं, 34 हमें साउथ अफ्रीकन वेरिएंट मिले हैं और 1 सैंपल ब्राजीलियन वेरिएंट के तहत पॉजिटिव पाया गया।
The new double mutant strain has been found in Nagpur and Delhi. The UK, South Africa and Brazil variants of coronavirus are also spreading far and wide in India. The government is calling these the variants of concern. They have been found in Punjab, Telangana and Delhi. Government says these variants are circulating in 70 districts. While some variants show immune escape capabilities and are more infectious, the government says there is no need to panic.
Mutations का होना एक natural process है. ये होता ही रहे। वायरस एक आरएनए का स्ट्रैंड है, जब वो रेप्लिकेट करता है उसमें गलतियां होती है, नेचर का नियम है। इससे हमें पर से घबराना नहीं है। तो म्यूटेशन से बचने का रास्ता हमारे लिए वायरस को हराने के ऊपर है।
The latest spike in cases has forced Delhi and Mumbai administrations to ban Holi celebrations. Maharashtra has now announced a lockdown in Nanded and Bid till 4th April. The good news, all above 45 years of age can get vaccinated from April 1st.
Vaccinate, vaccinate, vaccinate. That is the government's only mantra right now, as we now have variants of concern, which is the UK, Brazil and South African variants, as well as a new double mutation variant that could give us sleepless nights. But the question that we need to ask now is, will these variants be resistant to the vaccines that are currently being used in India? And are they responsible for the surge of cases of COVID-19 in the country? With Sanjeev, this is Milan Sharma for India Today.
Now, as India completes its 1 year of lockdown announcement, what have we really understood of this pandemic now? Sneha Mordani explains to us what have been the lessons of the last 1 year. Take a listen.
Pictures of a one-day Janta curfew imposed a year ago. And what a year it has been. From wishing the coronavirus away to understanding how a pandemic changes lives, we have come a long way. Here are the lessons of the last 1 year.
Testing is the only way to control the infection. From no indiscriminate testing, only isolate and test when required, to the rule of the ICMR, to following WHO's strategy of test, test, test. India took a while to change its position. Dearth of testing kits, those meant for RT-PCR testing, considered the gold standard of testing to rapid antigen testing. The pandemic taught us that an infectious disease can loom just about anywhere, and the way to nip it in the bud is test. The second important lesson, oxygen and ventilators are what we need. Oxygen therapy and the need to check dip in oxygen levels is what helped the medical fraternity save lives. Breathlessness, identified as the first sign of the disease worsening, oximeters became a way of life. From shortage of ventilators with just about 40,000 available, India became self-sufficient in not just procuring but also producing these ventilators. Another significant lesson, cities are more vulnerable. Crowded urban India serves as a perfect host to the infection. In spite of having the benefit of robust health systems, urban India collapsed faster. Rural India, where there is little congestion, managed to keep the infection at check. From a sense that asymptomatic patients do not spread the infection, to the understanding that they could be the biggest challenge in the fight against COVID, called asymptomatic carriers, these individuals can transmit the virus to others without knowing it. We now know that the virus can show no symptoms in some, but can still contribute to the spread. The infection prolongs in the form of long COVID, be it in the form of fatigue or lung damage or heart problems. The infection's initial symptoms may go away and it leaves an impact. That has been another lesson. Another lesson, initially it was thought that the lockdown would help break the chain of transmission. That was not to be. We opened up gradually and cases surged in August. The lockdown's purpose was to buy time to ready the country's infrastructure to deal with the mounting challenge.
And lastly, but most importantly, what we learned is that there is no substitute for this, which is hand hygiene, and also wearing the mask that will be protecting you against the new variants of the infection as well. Unfortunately, we see this being violated even as the country is looking to a second surge, a second wave of the infection. In New Delhi, Sneha Mordani for India Today.
Now time for our special COVID segment, The Good, Bad and Ugly. Here's a report.
Here is the good news of the day when it comes to the vaccination drive in the country. India could soon be having more than 2 options when it comes to the vaccine. Sputnik V, developed by Gamaleya Institute, and the bridging studies of which is being done by Dr. Reddy's here in India, is soon going to be getting emergency use authorization. Last month, the subject expert committee had sought more data from Sputnik V. Sputnik V has submitted this data to the drug regulators, and soon the subject expert committee could be looking at granting emergency use authorization to this vaccine. Apart from that, an interministerial group has been set up by the Government of India, especially to look into ramping up production supplies of doses in the country. This group visited the Serum Institute in Pune on Saturday, and on Wednesday they visited Bharat Biotech in Hyderabad to get a sense of how the government can then step in to help both of these companies ramp up production. Here is the bad news of the day when it comes to the pandemic. Cases are only surging. The worst affected states like Maharashtra, for example, is now seeing more than 31,000 cases, which is the highest ever since the epidemic really began last year. Delhi is seeing close to 1,200 cases. Cities like Mumbai also seeing more than 5,000 cases, and this is a huge concern. Deaths are also increasing. Delhi, for example, is seeing more than 7 deaths. States like Punjab, where the population is less and is seeing new cases, especially new UK variants, for example, is of concern, because the problem is that even if there is some amount of evidence to show that these variants don't necessarily cause severe infection, they certainly cause more infection, in the sense that the infectivity rate of these variants is high, is what really is the sense within the scientific community.
Well, this is the ugly side to the COVID-19 pandemic. Now, in a statement released by the Health Ministry, the consortium of labs that do genome sequencing to test and check for mutations in the country have found a new double mutation strain circulating in India. This is a strain that is showing double mutations instead of one mutation, generally experts say. This has been found in districts of Nagpur in Maharashtra, and some of the double mutations have also been seen in Delhi. This is concerning because India was already witnessing variants of concern that are the UK, South Africa and Brazil strains. Punjab happens to be the state that has the highest number of UK variant strains, cases that have tested positive in that state. Along with that, Telangana as well as Delhi is also showing more variant strains testing positive in the country.
All eyes now on Sachin Waze as the NIA custody of former Mumbai top cop ends today. But the former encounter specialist will be produced in court today, and the NIA is going to be seeking an extension of Waze's custody. Remember, the NIA has been probing the Antilia bomb scare case. A few days ago, Waze was taken to the crime spot and the NIA recreated the entire crime scene there. Remember, the NIA is also probing the Mansukh Hiren murder case. The central agency took over this case from Maharashtra ATS, which yesterday had named Waze as the key conspirator. Now, the Maharashtra's Hafta Gate controversy refuses to die down as the BJP on Wednesday mounted pressure on the Aghadi government. A Saffron Party delegation met with the Governor Bhagat Singh Koshyari to press demand for CBI probe into all these allegations. In fact, the Aghadi has hit back, accusing the BJP of using Raj Bhavan for political gains. Meanwhile, the Supreme Court asked former Mumbai top cop Parambir Singh to appeal in the High Court seeking probe against Anil Deshmukh.
Maharashtra, Hafta Gate warfare escalates. A day after Devendra Fadnavis met the Union Home Secretary seeking a CBI probe into alleged extortion and posting rackets, the party met Governor Bhagat Singh Koshyari to further press their demands. The BJP's attempt to get the governor's support prompted a counter by Aghadi government.
इतनी सारी घटनाएं होने के बावजूद महाराष्ट्र के मुख्यमंत्री जी ने उसके ऊपर एक बयान भी नहीं दिया।
राजभवन को राजनीतिक अखाड़ा भारतीय जनता पार्टी ने बनाया। आज बोल रहे थे देवेंद्र जी कि महाराष्ट्र की सरकार अस्थिर है, अस्थिर नहीं खंबीर है।
As trouble escalated for the Maharashtra Vikas Aghadi government, Chief Minister Uddhav Thackeray chaired a virtual cabinet meet with Home Minister Anil Deshmukh also in attendance. As the political battle rages, former Mumbai Police Chief Parambir Singh suffered a setback in the Supreme Court, which refused to hear his plea seeking a central agency probe against Deshmukh. The top court asked why Parambir did not go to the High Court first. The bench observed that the High Court has the power to order a probe into the top cop's charges.
The Mahavikas Aghadi government is strongly standing behind Anil Deshmukh. They are saying that this is a BJP conspiracy to topple the government. The BJP, on the other hand, is banking heavily on the two-letter bombs, one of Parambir Singh and the other of Rashmi Shukla. Now it remains to be seen if this Hafta hurricane will really topple the existing government. With cameraman Vijay Desai in Mumbai, Vidya for India Today.
Now with just 48 hours to go for round one of the big Bengal battle, it's a mega rally war in poll-bound state. The BJP is all set to maximize the campaign blitz in the last leg of the campaign. Home Minister Amit Shah, UP Chief Minister Yogi Adityanath, Defence Minister Rajnath Singh and actor-turned-neta Mithun Chakravarti will be addressing rallies across the state. On the other hand, Mamata Banerjee will also be addressing rallies on a wheelchair in the run-up to the Phase 1 polls, which takes place on the 27th of March. Remember, the first phase of polls have witnessed a fiery showdown between the BJP and Mamata Banerjee. Now, an attack on a group of Kerala nuns travelling from Delhi to Odisha 6 days ago by a group of Bajrang Dal men has now become an explosion ahead of polls in Kerala. A day after Kerala Chief Minister Pinarayi Vijayan shot out a letter to Prime Minister Modi calling for action on the same, Congress MP from Wayanad, Rahul Gandhi, now has condemned the attack, calling it a result of RSS propaganda. Rahul termed the attack on nuns an attempt to trample the minorities. Meanwhile, speaking to India Today during a campaign trail in Kerala, Home Minister Amit Shah assured of strict action against the culprits. The incident took place on March 19th when 4 nuns from Kerala-based Sacred Hearts Church were allegedly harassed by some Bajrang Dal men on train as it reached Jhansi in Uttar Pradesh. Moreover, the situation worsened when the police detained the 4 when the train reached Jhansi railway station and reportedly questioned them for 5 hours based on what the Bajrang Dal members alleged.
झांसी में 2 कॉन्वेंट की नन्स को एक अटैक या इंटॉलरेंस की एक इंसिडेंट हुआ है और उसके बाद में बीजेपी लीडर्स और केरला चीफ मिनिस्टर ने आपको एक लेटर भी भेज दिया है, उसमें तो आपका रिस्पांस क्या होगा?
नहीं, मैंने आज कहा है मेरी सार्वजनिक सभा में, जिसने भी एक घृणास्पद काम किया है उसको जरूर कानून के दायरे में लाया जाएगा, किसी को बख्शा नहीं जाएगा.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.